Thank you to all the panelists for being here this afternoon. Um, you know, things are changing in real time every day. It feels like a high volume and high velocity of change. But before we sort of embrace how the change is occurring today, I think it's important to level set and understand what the childcare landscape looked like, even just 3 months ago. So be curious if we could talk through how the federal funding landscape had evolved over the last few years and what certain key challenges remained even before January 20th of this year. So, Erica, I wonder if you might talk through a little bit about the federal funding landscape.
Yeah, I can start just with a high-level overview. Um, I think a really important point to convey is that there's no single source of dedicated funds for early childhood in the United States. What we have is a patchwork of federal, state, and local funding streams, cobbled together to make a system of early childhood programs. Um, for the most part, well, almost entirely, they're administered at at the state and local levels. So the majority of federal funding comes through two streams, and it's targeted to low-income individuals and families with specific vulnerabilities. So this would be the Child Care and Development Block Grant, CCDBG. This is the Child Care Subsidy Program, money block granted to states, territories, and tribes to develop and run a subsidy program and to improve child care quality. There's also Head Start, which is grants directly to private or public entities to deliver early learning services, wraparound supports for families living in poverty. That is below the poverty line, which for a family of four is like $31,000. So very, very low income. Most states also allocate a portion of their TANF, Temporary Assistance for Needy Family, block grant funds to childcare. It's called something different in every state because it's another block grant. But cash assistance is typically what it's known as. And then there's these smaller scale targeted funding streams for early childhood programs that are the federal level. So we have the IDEA funds, Individuals with Disabilities Education Act Parts B and C, which is preschool special education and early intervention programming. There's military childcare, as Caitlin mentioned earlier. There's the home visiting program. Tax credits. We could even dependent care tax credits are a form of support for early childhood and childcare. And one that is really important that I'm particularly a fan of is the preschool development birth to 5 block grant program. It's not direct funding for care, but it's a grant funding for program design and administration. So it's a very big resource for building like the foundational components that support the broader early childhood ecosystem, including data systems and quality enhancements, et cetera. So I'll stop there.
And Natalie, you alluded to this in your introduction, but you acknowledged sort of the underinvestment that FFN Care has received. And I'm curious if you could talk through some of the gaps that the federal funding ecosystem has created, at least from a home-based care perspective.
Sure. Um, so when we think about the childcare sector, we're really and think about the mixed delivery, there are various forms of childcare that families can access, including school-based care, something like pre-K, center-based care, where they may access pre-K or other childcare services in a community-based setting or a commercial childcare setting. Family childcare, which is a small business with a childcare license that operates in the home of the provider, and then sort of a myriad of diverse care options that we call family, friend, and neighbor care, where relatives and trusted friends care for young children in their home or the home of the child or the family. And really, we see that home-based childcare, both family childcare and family, friend, and neighbor care, is often excluded, from these funding opportunities and is sometimes an afterthought in kind of the design of policies. A lot of how we design our childcare system is based on best practices in these school and center-based settings. And so for home-based settings, often it is either this total afterthought or sort of a watered down version of what might happen in a more institutional or center-based setting. And as Erica alluded to, the federal funds that support childcare are administered by the states, and many states sort of interpret the flexibilities in the federal law to mean that they can exclude these diverse home-based childcare providers from their federal funding. So, when we think about the major funding gaps in the federal system, we think about two big problems. The whole pie is simply too small, and the share of the pie that supports, home-based childcare is tiny. So, despite being the most relied upon form of care in this country, only a tiny fraction of our federal resources are reaching home-based childcare providers, and even a smaller amount are reaching those kind of family members and trusted caregivers who are stepping up and stepping in to support families in meeting their childcare needs. This means that families who want and choose home-based childcare are often unable to access the childcare subsidies that they may be income eligible for or may meet the work requirements to access, because the kind of care that meets their needs is not recognized and is not eligible in the state where they reside. And this has a really negative impact to both families and providers, right? So this compounds financial stress for low-income families who are already struggling to make ends meet. Our partner at the Center for Early Childhood at Stanford and their rapid survey tell us that 41% of families with children under 5 are experiencing material hardship, which means that they're struggling to afford, one or more basic need like food, utilities, and housing. And childcare costs significantly compound that stress. And then this lack of access to federal programs and federal funding means that home-based childcare providers and many other early childhood workers are really grossly underpaid and experience major financial strain and economic instability. And so we see that over half of home-based childcare workers are experiencing material hardship. Nearly half of home-based childcare providers are regularly going hungry. And last year, we saw in the last quarter of the year, as many as 17% of the early childhood workers receiving eviction notices. So this sort of, there isn't enough money for the early childhood sector largely. And because so little of that money reaches home-based childcare providers, it's causing enormous strain to providers and to the families that they serve.
Appreciate you outlining that, Natalie. Caitlin, as you shared, you are a two-time public servant who's been responsible for making the patchwork that Erica laid out work for providers and for families. Curious if you could share your perspective on, some of the biggest challenges that this patchwork created for you and some of the strategies that you were using to try to make the system work for providers and for families and children.
Yeah, I think first and foremost, having led state agencies committed to this work, I think I just want to reinforce that every day I came into work and had to ask a team of individuals within state government to take on more work than they ever should have to. And typically to take on that work with the most unreliable tools and resources to be able to support our childcare providers. And so, yet, despite having those lack of resources and tools, they are often the ones at the front lines having to explain our policies and to have to explain our flawed funding structures. Federal funding is important, but it's certainly not the only answer to support a viable childcare field. And so I have a unique perspective in having worked in Rhode Island, where we contributed the bare minimum of our MOE, or maintenance of effort funds, to the Child Care Development Block Grant. Then shifting to Massachusetts, which had a dedicated Office of Early Childhood. We were really blessed with a lot of state investment in the childcare system. However, because it was a dedicated Office of Early Childhood, I was somewhat restricted in how I could braid or blend funding, particularly within the health and human services space. And so I just offer that as like a contrast. I thought that, in the state of Rhode Island, I was really compelled as leading health and human services to leverage Medicaid, TANF, social services block grant, community services block grant, really thinking about our public housing authorities, how to integrate innovative models that leverage and build capacity among childcare providers. In Rhode Island, we also worked with Housing Bond and housing advocates to incorporate childcare financing for facilities within that bond structure. In Rhode Island, in short, I felt like there was a real scrappy nature to identify the funding and to really optimize federal funding sources. However, every time I'd go to my state legislature in Rhode Island, I would bring a very visual chart, which would show that each and every year federal funding increased, our state would decrease its amount that it would invest in its early care and education space. And so while that is not always the national trend, I think it is very important for folks to think about how do we match but not supplant state funding that is being invested in our systems, particularly when there's local and community interest in also participating. We've seen a lot of innovation just in the federal space. Obviously, we have the Preschool Development Grant, which uniquely funds sort of capacity building, strategic planning, needs assessments, work that oftentimes goes overlooked within the grind of day-to-day state government or administration of benefits. And so I do think that the Preschool Development Grant really offered a unique opportunity to do some system design to rethink how we subsidize and support the field. I think ultimately some of the findings of those grants maybe influence the CCDF final rule. But ultimately, I think what is most missing is within our child care development block grant, there in Medicaid in particular, you have a dedicated earmark for technology or data related costs. Childcare is just expected to foot this bill, whether it be within its quality earmark, which is a dedicated set aside of funding for capacity building, professional development, technical assistance, whether it's in a 5 or 6% admin fee that you cut. There's really no dedicated fund source to build the online tools and technology that are really needed to enhance the sector. And as a result, you have childcare providers scrambling, procuring their own software systems, trying to manage family communication, working to take photographs to directly communicate with families to build engagement. And as is too often the case with public infrastructure, this burden rests on individual childcare providers as opposed to the system. And this is just unacceptable. There needs to be a large scale system investment in sort of how we support infrastructure, with IT and technology and data management being a central component of that. All too frequently, I hear, we try to engage CCRNRs, we try to engage community-based organizations, and I almost always ask the question, well, how are they resourced to lead that work? And I very inconsistently hear that they were provided funding. And I think that that is a tremendous gap, right? I think we need to be cognizant of what we are asking providers, families, and others in this community to take on free of charge. And then the last thing I would say, particularly with regards to innovation, is I am a big believer in employer-based childcare. I think that we need to invite new players into the space. I think that this needs to be regulated and influenced in a strategic way. I think I want to remind folks that the Child Care Development Block Grant was established as a workforce development support. It is geared towards low-income working families. It is often properly integrated, either through integrated eligibility or with coordinated enrollment with other health and human service programs. We cannot treat employer-based childcare as a separate silo. It needs to be incorporated into our ecosystem of early learning. Otherwise, we risk sort of seeing kind of similar to what we saw with Universal Pre-K, where it was this boutique program that wasn't properly integrated. There's an opportunity to holistically serve all families and all children and really benefit them throughout the integration of other services. And I see this as yet another unique opportunity to do that. And it's really exciting to be able to invite new partners, such as employers, to do that. So this is an area that I'm really interested in working on moving forward.
Thank you so much, Caitlin. There's a lot in there, and I think it's a really wonderful segue into another talking point. Erica, Caitlin talked through creatively braiding funding through thinking about legislative advocacy work. I know that you are working with a community of practice on thinking about engaging states and localities, and curious, what are some of the strategies you've also seen sort of states or communities engage in to try to get over some of the federal underinvestment that we alluded to earlier in the webinar?
Yeah, so funding takes an enormous effort, but it's part of it. It's like half the battle. I think one thing we see a lot of is communities are increasingly going to the ballot to raise funds for local initiatives. The Children's Funding Project can be a really powerful resource and support for that. Another thing that we've seen in these more locally led initiatives is partnering with the business community and getting local businesses to front funds, infrastructure, invest in the care and education of children. Something that we hear a lot is that make every issue a childcare issue to really stir up investment in places and that you wouldn't normally expect it to come from. I don't know so much that it's funding, but this community practice that we've built is really key to delivering on implementation, right? So you get the money, but then there's this whole piece of like, okay, but then how do you make it happen? And oftentimes so many resources are dedicated to reinventing the wheel, really. And so this group that we lead really is a place where tangible lessons and resources can be shared, and they actually transcend geography. So I can pause there and let others join, but
Well, particularly in the resource scarce environment that Caitlin mentioned, without allocated and earmarked funding for things, I think to your point, having a community of practice and replicating best practices across geographies is critical. So it's really exciting work that you're leading. Natalie, and on the issue of sort of state best practices, curious how you've seen states show up in good ways or less encouraging ways in catalyzing or supporting FFNs, and would love to get your perspective on that.
Sure. So this is a really complicated issue because the federal government does not define what a home-based childcare provider is and really allows states to do a lot of that defining at the state level. So there is a lot of variation in terms of who is included in a state's definition of a home-based childcare provider, who meets the criterion of being a family childcare provider or a family friend and neighbor caregiver. So for example, in my state of Pennsylvania, a provider that we would think of as a family childcare provider across the border in New Jersey may be thought of as a family friend and neighbor caregiver. So there's a lot of variation even at kind of this point of defining who is and isn't a part of the formal system. And a lot of that flexibility really allows a lot of, the federal government kind of allows states to use CCDF dollars to support FFN, but does not direct them to do so. So there's significant variation in terms of state investment in this aspect of the childcare sector. Many states interpret the federal rules as not being supportive of FFN care, and many took, the opportunity around the reauthorization in 2015 to eliminate or severely shrink their investment in the family friend and neighbor aspect of the sector. But there are some states and there are some local communities that are really doing an amazing job of uplifting and supporting their FFN care. And I'll just share a couple of examples. In the state of California, home-based providers are unionized, and that is a 40,000 person bargaining unit that includes both licensed family childcare providers and licensed exempt family friend and neighbor caregivers. And these providers have had major victories in increasing their subsidy reimbursement rates and gaining access to critical benefits like health insurance. In Colorado, the state passed state legislation creating a care worker tax credit that provides a $1,200 refundable credit to care workers, including all forms of home-based childcare, including family childcare and family friend and neighbor care. In King County, Washington, a partner with Homegrown, the county raised local levy dollars to create a subsidy program that supports family, friend, and neighbor caregivers who are excluded from the state subsidy system, recognizing that those caregivers are meeting, immigrant and refugee family childcare needs and folks who they really want to ensure have access to appropriate childcare supports. King County has also recently launched a wage supplement program for their family childcare providers, kind of adding additional financial support to providers. And then we are currently working with the city of Austin, Texas, who is offering kind of an annual cash credit of about $2,000 to home-based childcare providers to offset the cost of their property tax. And this is really to mirror a recent state action that allows facility childcare, commercial and center-based childcare providers to seek some relief for the cost of their property tax. So the city of Austin is making kind of a direct cash payment to support home-based providers in some tax relief. So those are a few examples, and that includes FFNs from around the country, where we're seeing both local and state governments, raising new revenue or using the existing programs to better support family, friend, and neighbor caregivers.
Thank you, Natalie. You've all sort of articulated really interesting and unique policies that are emerging across the country that are showing some degree of efficacy. Caitlin, you've also sort of articulated a desire to have sort of a policy that just mirrors other federal allowances for technology. So there's certainly no shortage of policy priorities that we might try to think about and embrace. I'm curious, if you had the ability to wave a magic wand, which of the sort of policy priorities might you want to put in the lead, or what are some of the models that you articulated that you're most excited about and think have the most exciting opportunity to expand in other communities across the country?
I'm happy to take this one. I unapologetically feel very strongly that data needs to be an upfront investment in what we make and what we build in our childcare infrastructure. During COVID-19 response for two governors, both in Rhode Island and Massachusetts, I was called into daily briefings throughout the pandemic and asked the same question: how many children do we have in childcare? And I never had an answer. We ended up automating surveys, manually collecting data, building Python scripts and Excel spreadsheets because we weren't provided a budget. And ultimately, we were not able to determine the true supply and demand of childcare. And as a result, it impacted the level of sophistication we could put into any type of fiscal notes or budgetary recommendations for expansion in the system. We have to know what the true supply and demand of our system is in order to effectively compensate it. Too often when you see, and COVID was a unique opportunity in state government because you saw an influx of funding, some temporary provisions around procurement removed. And so there was this unique opportunity with direct exposure to leadership in your government, with governors, et cetera, to be able to move really impactful policy or innovative ideas to enhance service delivery, largely related to health and safety, but ultimately it very much impacted the quality and the stabilization of programs. However, as we looked through that, there wasn't a lot of work in terms of building capacity. It was stabilizing an existing system, salvaging what we could from our existing workforce, building out better wages or compensation. From a legislative standpoint, what I saw both in Massachusetts and Rhode Island, and quite frankly across the nation, is there was a focus on improving access, whether that was reducing eligibility requirements for families, making more families eligible for public assistance, all of which I believe should be a top priority. However, without slots to serve these families, we are very limited in how much we're going to move the system. And so much of what prevents us from being able to build new slots is not having the data to be able to justify it. And so this is one area that I would really like to push on. I think that there are a lot of comprehensive solutions in the market. They just need resourcing. And I don't actually think that the federal government is the right entity to resource it. I think this is an opportunity for philanthropy to open the door to really think about. And I have experience with philanthropy. Some of the most innovative work I did was pilot work that was funded by a foundation, gives you an opportunity to really tinker, to really experiment with the program design, determine efficacy, build a use case for sustainability and scaling, and then go to your state legislature or then go to the federal government with a sort of solution that you can operationalize across for multiple entities. But I do believe this is a fundamental gap, and I think that we need to rebuild also some of our strategic, not leverage, but there was a lot of innovation that came out of the pandemic. There was a lot of willingness to think differently about the work. there was, for a lot of folks, particularly in state government, there was a lot of we could never do that, we're not able to do that. And all of a sudden, those things sort of sunset with the opportunity of additional funding and better visibility from our leadership. And so I just think when, folks are really committed and there's coordinated messaging around what the top and most important priority asks are of funding and legislatures, there is an opportunity to move that policy. So.
Thank you, Caitlin. It looks like you have a lot of folks who agree with you in the chat. Natalie or Erica, any other policy priorities that you're particularly excited about or would want to call out once more?
I would just plus 1,000 to everything Caitlin said, but also making sure that when the federal government issues rules and regulations, they understand the current technical capacity and the antiquated data systems that states are working with, and just how long it takes to get up to speed, everything they're going to need to do to implement and come into compliance with certain regs. I think we saw some of this happening with the rulemaking in 2024 with the Child Care Development Fund, and states commented, like, hey, we need a longer runway. This is not practical. And then, that was part of the consideration that led to the waivers being issued, or, issuing waivers to have longer runways to implement it. But there's still no money. And so, as Caitlin said, it's an area for philanthropy to really step in. And at the lab, our goal is to really learn from places that have already done it and make it easier for the next place by sharing the lessons and hopefully getting them that much further along in the process to make it, a little easier.
I would just add, and I totally agree with what Erica and Caitlin shared. I would add that I think we need to really focus on what parents want when we think about adding capacity, right? I think we kind of have this mental model of supply building that is brick and mortar projects, expanding centers and community, and schools, standing up or expanding organizations and hiring lots of new staff. But when we ask parents, what kind of care do you want and need? Parents are telling us that they want home-based childcare and relative care. And parents are telling us they want care that's full day, full year, with flexible hours, with culturally or linguistically congruent caregivers. And so there is some disconnect between sort of where we're making investments in supply building and what families are telling us that they want in terms of what that care looks like, the setting in which that care occurs. We have some really nice data from Child Trends that's shown us that as the supply of home-based childcare in communities declines, parents' overall satisfaction with the childcare market also declines. Parents want home-based childcare to be a part of the supply and the options that are available to them, and they're less satisfied with the market when those options are not there. And we also can raise that one-time funding for the capital investment in facilities, but we are not currently in a place where we can identify and attract a workforce that can meet the demands of families. And I will offer a very low-tech innovation here, which is that there are 5 million caregivers who are already providing care to young children. They're called family, friend, and neighbor care providers, and they are largely excluded from even our conception of existing supply. These are folks who are committed and dedicated to supporting young children. They already have facilities, either in their own homes or the homes of the young children that they serve. And this is care that parents want and choose often. And so I think as we think about where to make new investments or where to make policy changes, a big opportunity for us is to recognize and value the care that already exists in communities and ensure that as we target new investments, that we are cognizant and really sensitive to the priorities and preferences of parents and some of the existing care arrangements that parents rely on and value.
Thank you, Natalie. And thank you, everyone, for really insightful advocacy here. Caitlin and Erica, you both mentioned data quality And you've mentioned technology as well. And technology, of course, speaks to a lot of different friction points across, different points within the childcare system. So you have everything from search and referral to fee assistance administration, things like tracking attendance, getting payments out on time. Caitlin, you are in real time responsible for a fee assistance program. So I'm curious if you can sort of talk through some of the biggest friction points you see across different parts of the childcare ecosystem, Erica, particularly as you're sort of thinking about implementation, and how this is leading to disruptions in communities and some of the things that we might be able to tactically move forward, at this period in time.
Yeah, sure. I mean, I've had the benefit of operating a childcare subsidy system in one state that utilized integrate eligibility. So that was an opportunity. Integrate eligibility was a unified software system that integrated 13 different public benefit programs, meaning that families would apply for public benefits and have the opportunity to select in one application from 13 different programs. Ultimately, what that meant in the state of Rhode Island is that childcare oftentimes was neglected in terms of the enhancements or the prioritization of software that was needed to better and properly serve our childcare providers. I don't think that was intentional, but when you are in a room negotiating enhancements or software changes where Medicaid has about 10 times the budget of a childcare development block grant and has large implications for healthcare, provider payments and so forth, it is very difficult to be nimble. And so that was one unique experience I brought, as opposed to in Massachusetts, where we were able to individually procure software. I often tell the story. I cried the first time I saw Salesforce in Massachusetts as our licensing education and database. There was a lot of challenges, but there was a lot of opportunity. And immediately when I went into Massachusetts, granted, everyone should have the Massachusetts budget, but I thought uniquely about, like, what if everyone had access to these kinds of tools? What if they had these types of resources that were at their disposal to be able to properly serve families, providers, and also be able to administer grants and so forth? And I think this is an important thing to think about in terms of professionalizing our field and making sure that families, when they come into our system, no matter what their economic background is or their demographics, that they experience a polished experience. This is, customer service 101. And it also deeply concerns me that states are having, and local community-based organizations are having to cobble together a patchwork of solutions, right? So they have a mobile app for one sort of set of solutions, but then they need a comprehensive case management system for another. And oftentimes our community-based organizations are not even in the position to have governance over the procurement, funding, or administration of those software services. And so this is really hard. And I would also say that I never went into public service thinking that I would need to be an IT professional. I also never thought I'd need to be a CFO, but that is like ultimately it's similar to childcare employers, right? And childcare employees. We expect them to be nurses, we expect them to be social workers, we expect them to be educators, we expect them to be psychologists, to be business owners, to be technical assistance providers. There is a real over-reliance on the field and on the system to be able to support our children. I often tell this story just uniquely about my own family, and that, my child needed comprehensive and very complicated neurosurgery, went through a 2-year discovery period before diagnosis. In absence of having a healthcare system that could adequately serve his needs, I had to rely on our childcare system. They had to develop accommodations, they had to develop plans, and they did. And consistently, that's what we see across our childcare field. K through 12 schools had to close due to the pandemic. Childcare providers rose their hand and offered emergency childcare services. This is a very resilient workforce. It's one that's committed to the work, but we've not properly resourced them with the tools to be able to execute. And so I think one experience that I offer is just the unique differential between offering an integrated eligibility system where you might lack autonomy, but there's more comprehensive solutions available to families, versus being able to really not sit in an island, but be able to operate an individualized software system that directly benefits childcare, where you have a budget and an influence to be able to code the software in the way that the system needs, without consideration for other public benefit programs and the downstream impacts. I think both are different, but I think ultimately what I would share as an objective is that we need to reduce our over reliance on the field to just figure it out. Whether it's me personally as a state administrator or a childcare provider that's being expected to do absolutely everything in the kitchen sink, no one can feel successful and no one can feel viable in that type of work environment. And so, as much as we can leverage support to build that infrastructure, I think there's an opportunity to really rebuild the system and support more proactively.
Thank you, Caitlin. And Erica, I saw you doing some nodding. No doubt this has been a theme in the implementation work that you've been doing. Curious if you have anything to add to that perspective.
I would add that one of the technology is wonderful and is very needed. I think I would caution against technology for technology's sake, right? So like, please look at what's under the hood. Like, it may sound great to automate a form, but what if what's being asked for on that form isn't needed, right? So there are burdens that that don't need to be continued through technology. Another thing is that some advances that really help the administration of these programs and the data issues and et cetera can be very costly. And so childcare management software, and particularly when you're thinking about home care providers, that can be a barrier, right? And so there are some states that are actually subsidizing the cost of that to encourage participation in the childcare management software, so they get better data, so that families have more information about what care is available, where there's openings, costs, et cetera. And that's all I'll add.
Thank you, Erica. Natalie, anything you want to talk through on the technology side?
Yeah, I mean, I want to definitely reinforce what both Caitlin and Erica said, which is tools alone are not good enough. We need policy to enable them to be effective. And I would really love to talk about the work that we have been doing with Beam in the Thriving Providers Project. The Thriving Providers Project is a project where you use guaranteed income strategies to support the home-based childcare workforce with twice monthly direct cash payments. The project seeks to model policies and approaches that support the economic stability of the childcare workforce. And we're hoping to learn how increasing the stability of providers increases access to care for families, improves the quality of care to children, and strengthens providers' longevity in the field. Beam has been a tool for us to reduce application burden and to get timely and accurate payments to providers. The tool enables us to meet the targets of our project, which are that applications take no longer than 15 minutes to complete, that applications are accessible in appropriate language and literacy levels, that providers are paid in ways that work best for them, whether that's a direct deposit or a mobile debit card or other forms. And most importantly, that cash arrives reliably on the same day every 2 weeks without interruption. That is the guarantee that this workforce deserves so that they can be financially stable and do this really hard work. We're thrilled by the federal rules around encouraging prospective payment and use of contracts to create, stable and timely payments. And I strongly believe that direct cash approaches like those in the Thriving Providers Project and the capabilities of tools like Beam can better support the workforce in getting that continuous, stable, and appropriate funding so that these incredible individuals can do the work that's most important, which is caring for young children and not worrying about whether they can put food on their own tables, whether they're going to be evicted from their home, or face other, economic consequences that undermine supply and erode quality.
Thank you, Natalie. And it's been a true pleasure to be able to partner on that important work together. We are now in the Q&A portion, and I've only seen one question so far. I do want to make sure that we create space to answer it. So there's a question in the chat that asks, are there any panel perspectives on good examples of public-private partnerships that show promising examples for potential replication elsewhere?
So this is interesting, right? I think there's a number of different public-private partnerships that are being piloted, many of which are very premature to be able to speculate efficacy, particularly around TriShare, which I am actively monitoring and really interested to see sort of the benefits. I think one thing that excites me about TriShare is inviting private entities into the market. I think it's unfortunate that so much of our investment in the childcare space ends up trickling down into additional costs for the family, or we're expecting providers to do more without considerable compensation for what they're being asked to do. Public-private partnership for me can be rather difficult in terms of the IT or technology space. I think it is, really challenging, particularly for states or community-based organizations that don't have the dedicated internal resource capacity to be able to vet or surveil IT products or software. And so that is one area within Childcare Aware of America that we're really trying to lean in. Not that we would necessarily endorse products, but we certainly want to be really knowledgeable so that we can support our CCRNRs and other community-based organizations. And we're building networks of state administrators to be able to adequately understand and assess the capabilities and the implementation associated with any type of software or data technology investment. I think this is an interesting public-private partnership that has not really been fully sort of vetted as part of the market has evolved. I will share that one thing that we did, and I will say, like me myself, like the way that we design software makes it really hard to scale. It makes it really hard to be interoperable, particularly within the childcare space. Each state has very unique requirements, very unique policies, even in terms of how we define household income, how we define co-payments, like all of these vary significantly from state to state. And so we are certainly not making it easy on private entities or private partners to be able to create software or create systems that can be easily replicable or scalable. I think that states have an opportunity to influence the market in this way. And so in Massachusetts, one thing we did was we signed an MOU with the state of New Hampshire. We actually provided them our code base for our childcare case management solution. Now, because of limitations within capacity, it was ultimately it was placed on a vendor to begin to implement that code sharing. Like we had the MOU, we prepared the code, we shared it. But then oftentimes when it came to ask around the implementation, they often shared it's somewhat limited, right? Because we're at the disposal of the vendor to be able to determine what can be reused, what can be implemented, et cetera. And so I think there's real opportunity for states to build capacity, obviously with funding, to really be able to influence and inform the market. I think even some of the custom off-the-shelf products that I'm having the luxury to be able to demo or have visibility into often for me don't feel like COTS. They feel like a custom template that is then being put in front of community-based organizations and states with considerable timelines to have to customize. And so that just takes real capacity, and no one really has that type of capacity, nor do they have the budget to implement. And so I think that there's an opportunity either with foundations or with national organizations like ChildCare Aware to be able to build some reciprocity in communities of practice, to be able to facilitate code sharing, or at least help to generalize or simplify the terms and policies that we're working to incorporate within the design of our software. I really do think that that needs to be a high priority because I look at some of these contracts in some of these states who are working on large scale tech implementations, and they're in for tens of millions of dollars. I mean, that is money that really should be going directly to families and children and providers. And so I do think that there is a responsibility on us as a public sort of national organization to be able to better understand this and to ultimately influence it.
I would just add, I think sort of situating where the private player is in this is really important. And I agree with Caitlin, like seeding innovation, supporting infrastructure building is an appropriate place for private investment, but the ongoing operating costs associated with delivering high quality childcare needs to come from the public source. And we really need kind of a narrative and a buy-in to childcare as a public good so that we can, get the appropriate level of federal, state, and local investment in our childcare system. The Thriving Providers Project is a public-private partnership. It's actually a national-local partnership partnership. Homegrown as the national funder is kind of bringing a set of infrastructure investments to a community that wants to replicate this program. And then we work with local funders, whether those are private funders or public funders, to implement the program and then support that community in taking the learning of the project into their local or state policy conversation. So, we are really leveraging our private dollars to support infrastructure, supporting bringing a partner like Beam into these local communities where they can support partners in managing a program like this, but also our national evaluator at Stanford and our amazing benefits consultants and things like that to bring resources to communities to kind of establish programs like this that ideally kind of local public dollars can sustain, or where these projects can inspire local policy changes to sustain wage supplements or direct cash payments to providers. Homegrown also works very closely with city, state, and local governments in a project we call Building Comprehensive Networks, where we seed invest match alongside government partners to build networks of support for home-based providers. And, really, again, see a lot of promise in these private partnerships, but want to be modest and appropriate in the role that private funders can play at really this kind of front end sparking, building structure, and recognizing that we need appropriate policy and much more significant investment to maintain this work for the long haul and get families what they need.
Thank you, Natalie. I see one other question in the chat, sort of speaking to the intersectionality of childcare issues. I know, Natalie, as you were sort of teeing up some of the FFN work, you alluded to the fact that many folks giving care end up facing eviction themselves. So question is asking about opportunities for pilots or other programs that consider this intersectionality in multiple funding streams. Certainly the Nevada home-based care rental assistance program comes to mind, but curious if folks have any examples that might speak to that.
In Rhode Island, we did a lot of innovation, particularly during the pandemic with our public housing authorities. We were able to leverage childcare funding to develop some pilots within those housing authorities to provide care and education for children. We found a lot through family needs assessments that were administered through the preschool development grant that the majority of families wanted to access early education and care. They just were either limited through transportation or other means to be able to access it. And so by bringing those care and that opportunity to them, and I think this is a little bit of what Natalie has spoken to with the friend, family, neighbor care, it's really meeting families where they're at, being innovative with the program design, piloting different service delivery models. I think all of that is important. When we ended up piloting childcare within the housing authorities, what was interesting was that it activated a lot of other federal funding sources. We were able to use LIHEAP to install air conditioners, not just in housing units, but in common areas where childcare was being delivered. We were able to activate Social Services Block Grant, where we were able to introduce domestic violence prevention courses and et cetera. And so there was a really integrated approach. It was an opportunity to think about the leverage and the integration of so many different federal funding streams to support the whole family and the whole well-being. We also mobilized eligibility technicians from our state administrative offices to be able to run benefits directly in the housing authority. So I think there is so much opportunity when you think about housing and in particularly thinking about the interoperability. I would also just share as a little bit of background. I am an early childhood educator. I moved to Rhode Island as a Teach for America volunteer. I committed to a year of service and was placed in Providence schools. After I committed to that year of service, I actually ended up working in early intervention, which is a home visiting program in the state of Rhode Island. It supports children birth to 3 during their critical brain development years, providing services in the home for children with either developmental disabilities or environmental issues which might impact their growth and development. Through opportunity with delivering services to children in their home, you learn so much and you are able to support so much more than just the individual education of a child. And so I often talk about this, particularly across when I meet with educators in the field. Early intervention gave me the opportunity to be coached and to be, side by side with occupational therapists, physical therapists, speech therapists, nurses, nutritionists, really learning a holistic approach to supporting children. And it also helped educate me on other public benefits and social services that benefit a family in addition to just direct service and care and education. And so I do think that integration is incredibly important. I think depending on where you're at in a state or local community, it oftentimes requires governance or shared governance across multiple entities, which can create more complications. But I always say it's the hard that makes it good. And so being able to coordinate that work and to move it is really, really important. So I think that would be what I would want to share there.
Thank you, Caitlin. There's one more question we might squeeze in from Martha Ray. The recent CCDF rules, final rule strengthened capitation, pay by enrollment. While the state is subsidizing, it will then cost $30 a month per enrollee. Many programs are going to struggle with this transition. Are there any technical companies out there that can do this for less? I mean, I'll say, Martha, we'd be happy to have a conversation with you, but Caitlin, you also might be well positioned to think about, how states are going to have to deal with this transition. Of course, Eric or Natalie, if you have anything to add as well, please jump in.
I'd be happy to have an offline conversation with you. I mean, when I read the CCDF final rule and looked at all of the different policy changes, while so many are exciting and will benefit families, my heart went out to state administrators that are forced to implement with very little budget. And so even as you read through the fiscal note in terms of, what would be the technical costs with with making those adjustments in the software, it was just so short-sighted in terms of what's actually needed to be able to implement not just coding software, but change management, training, gradual release, like all of these different aspects and components for supportive program delivery. And there is nothing more important than making sure a provider gets paid. Let me just tell you, as a state administrator. And so I can understand that there is a real need to better understand the options that are available. And so depending upon what your current software is and where you're headed, I'm more than happy to provide some consultation there.
Well, we are pushing up on 2 Eastern, so I just want to extend a massive thank you to Caitlin, Natalie, and Erica for today's wonderful conversation. It's been a tremendous pleasure, and a huge thank you to everyone who's joined us this afternoon. Hope that we can take a lot of these great insights and put them into action. And again, I'll just encourage everyone. This is meant to be a community of practice. So as Caitlin offered to connect with folks offline, if there are any follow-up questions that folks may have, I certainly don't want to speak for anyone, but I have no doubt that everyone here would be excited to connect offline to the extent that would be desired. So wishing everybody a wonderful rest of your week, and thank you so much again for joining us this afternoon.